septic arthritis. Okay, septic arthritis. Now, in the beginning, can anybody tell me what is septic arthritis? Yes, what is this?
Pyogenic infection of the joint.
Very good. Excellent way of answering. Okay. Pyogenic infection of the joint. Very good. And there is a collection of pus inside the joint cavity. This is known as septic arthritis. So see there, in the beginning itself, this slide is telling us it is characterized by pain, redness, swelling, and warmth at the affected joint. But even rheumatoid arthritis is having these features. But rheumatoid arthritis and septic arthritis are not the same diseases. Rheumatoid arthritis is autoimmune disorder. Okay, this is predominantly an inflammatory disorder, whereas septic arthritis is an infectious condition. The microorganisms, the pus-forming bacteria have entered into the joint and they have caused infection there. So this is septic arthritis. So with this background information, let's enter into the topic. Now see this. This is also called pyogenic arthritis, infective arthritis. See here, infective arthritis or suppurative arthritis. These are all the synonymous terms for septic arthritis. There is a pus formation inside the joint, which is known as suppurative inflammation. Most commonly, it occurs due to hematogenous spread. Just like acute osteomyelitis, hematogenous spread is the predominant mechanism by which microorganism reaches into the joint cavity. But sometimes it may be due to direct spread from a penetrating wound or a neighboring infection, which is known as contiguous focus of infection. For example, a soft tissue infection is there very nearby, like infection of the skin or infection of the soft tissue that may move into the joint, which may cause the infection. And these are the difference. For example, acute osteomyelitis and chronic osteomyelitis. These are maybe the neighboring infection. If I take an example of knee joint here, upper part of the tibia may be having osteomyelitis, and especially in a very small babies, those blood vessels can directly enter into the epiphysis and then into the joint cavity. But in older children and in the adult, this type of infection is not that very common. Let's move on. Now, we have got one more definition of septic arthritis these days, and that is, based on synovial fluid aspiration and culture. Now, we can aspirate the synovial fluid from that joint to confirm whether this is septic arthritis or not. So, a positive synovial fluid culture or a synovial fluid WBC count of more than 50,000 with 75% of polymorphonuclear neutrophils and a negative Lyme titer is also confirmatory of septic arthritis. Now, what do we mean by Lyme disease? What is Lyme disease? Anyone? What is the causative agent of Lyme disease? Very good. Borrelia burgdorferi. Excellent. Borrelia burgdorferi. Okay. It is transmitted with the bite of a tick. So it is tick-associated disease. And in that condition also, there is involvement of the joint. There is arthritis. So we need to rule that out. Some antibody tests are done to rule that Lyme disease. But more important than that, when we aspirate the fluid from the joint and analyze it in the lab, the WBC count should be very high and 75% of them should be neutrophil. Then only septic arthritis diagnosis is confirmed. Most commonly, the children are affected because of septic arthritis, especially very young children. The premature neonate, the elderly population, and the immune suppressed. The elderly and immune suppressed have some other reason because their immunity is low. Even the premature neonate, their immunity is very low. But the very young children, We have discussed in the acute osteomyelitis class, the arrangement of the blood vessels in the metaphysis is very typical in them. Okay, that blood vessels are extended up towards the epiphysis also. So because of this, infection from that osteomyelitic site can easily enter into the joint. That's why osteomyelitis and septic arthritis are quite common in children. Now, generally, septic arthritis is a monoarticular type of problem. Means single joint is involved, monoarticular, and occurs often in the knee and the hip joint. But it may involve any joint. More common are knee and hip joint. In infant, there can be multiple joint involvement as a feature of septicemia. Now, look at this slide. It is a very informative one and very, very easy for you to understand also. So please take a bit of time and see there, all of you. So these are the routes by which the bacteria can enter into the joint. Now, this is a knee joint, isn't it? This is a knee joint. Lower end of the femur, upper end of the tibia. Okay. Now see there, number one is a hematogenous route of the dissemination. You can clearly see that hematogenous route. And here is a blood vessel. So through the blood vessel or through the flow of the blood, the organism have entered into the joint cavity. So no need of any discussion here. I have told this so many times in my previous classes, how microorganism or the bacteria reaches the blood. There are so many different ways. Okay. So once there is bacteremia, they can easily go to any of the tissues through the blood flow, and joint cavity is one of them. Number two, look at this. Okay. Number two, dissemination from osteomyelitis. Lower end of the femur and upper end of the tibia are the very common site for acute osteomyelitis. Even for the chronic osteomyelitis, they are the common site. So contiguous spread of the infection from there can occur into the joint, especially in very young children. Now the third mechanism, you can see here. See this. Okay, third mechanism is shown here. It is spread from an adjacent soft tissue infection. Now, okay, this is also contiguous spread of infection, you can say, because the infection is nearby. So soft tissue infection like skin infection, okay, subcutaneous tissue infection like cellulitis, they can go into the joint cavity. Number four, see here, okay, so this is a syringe and the needle. So diagnostic or therapeutic measures, if they are not done properly, if somebody do not clean this area and directly enter into the joint, okay, with the help of this needle, or if this needle and this syringe is not sterilized, so bacteria can enter inside. And the fifth one is a penetrating damage by puncture or cutting. So this is because of the trauma or the wound. Okay, see the rupture of the skin here. Okay, loss of the subcutaneous tissue, and bacteria can easily enter into the joint. So these are the routes by which bacteria can reach the joint to cause septic arthritis. Excellent slide. Now, what are the predisposing factors? In which type of cases, or if the patient is having certain conditions, then there is more chances of having a septic arthritis. What are those? These are called predisposing factors. So debilitating disease in a patient means chronic disease, long-standing disease, terminal diseases, infection elsewhere, such as an infected leg ulcer, definitely, bacteria can migrate. Rheumatoid arthritis, immunosuppression condition, or somebody who are taking corticosteroid. Diabetes, very old people when age is more than 80. IV drug abuse, it's a cause of bacteremia. Alcoholism, okay, the overall immunity is poor. Previous intra-articular corticosteroid injection. Through that injection, the bacteria can enter inside. Recent joint surgery, there is trauma to the joint. Joint prosthesis, these are the artificial devices which we have kept inside. They may be infected if the sterilization is not proper. And penetrating injury, like bullet injury, like knife injury, like a compound fracture near the site, any of these can act as a predisposing factor. Now, let's talk about what are the causative agent or the infectious agent in case of septic arthritis, which is an important part of the class. So please focus. It is most commonly caused by Staphylococcus aureus in adults again, or overall. This is the most common organism overall. Okay, so see that it's a quite a easy answer for you. Acute osteomyelitis, chronic osteomyelitis, or even subacute osteomyelitis also caused commonly by Staph aureus, whereas septic arthritis is also the most commonly caused by Staphylococcus aureus. We need to consider coagulase negative Staphylococcus in patient with prior joint replacement. Now, let me explain about this. Coagulase negative Staphylococcus, one good example is Staphylococcus epidermidis. Staphylococcus epidermidis. Now, this is a common commensal of our skin. So see there, what they have done, they have replaced the joint, means they have done surgery there. So that bacteria which is present on the skin can migrate inward, okay, if the proper cleaning or the proper procedure is not done, and this can cause infection later on. So you understand like that. So this is Staphylococcus epidermidis infection. Okay. Now consider Neisseria gonorrhoeae in sexually active adults and the newborns. In the newborn, they get this bacteria from the mother during the process of birth. But in sexually active, this is a case of sexually transmitted infection. So Neisseria gonorrhoeae can lead to involvement of the joint. Most common route of infection is hematogenous, already talked about, but it also may be caused by Streptococcus pyogenes, okay, Haemophilus influenza, and pneumococci or Streptococcus pneumonia as well. Haemophilus influenza is common in those children who are less than 3-year-old, especially if they are not vaccinated with HIV vaccine. And sometimes even the gram-negative rod like E. coli and Pseudomonas are responsible. So many other organisms can also lead to joint infection, but all of them do not form the pus inside. Now, what is the pathophysiology? So what is really happening, okay, inside the joint? Now, you can mention how the bacteria enter into the joint in this pathophysiology question, okay? That is called mechanism of infection. This is a part of pathophysiology. But let's focus here. What is really happening inside the joint? Now, in the beginning, there is acute synovitis with purulent joint effusion. So this is acute infection of the synovial membrane. And along with that, there is exudation first, and that exudation will turn into pus. After that, there is attack of articular cartilage. Okay, please correct the spelling here. This is articular cartilage. Articular cartilage means cartilage present inside the joint. Okay, this articular cartilage will cover the bone which are involved in that joint formation. So this articular cartilage will be attacked by this infection, okay? And these bacteria have certain enzyme. During the inflammation also, the inflammatory cells will produce certain enzyme. These are called proteolytic enzyme. They may damage that cartilage. If the infection is not controlled, the destruction of the articular cartilage occur, okay? And then what happens now? When the articular cartilage is destroyed, the two bones, okay, which are a part of that joint, will come very close to each other because the articular cartilage was covering, the end part of those bone, but those articular cartilages are gone now, they're damaged, destroyed. So the bone will come nearer to each other, and still if the infection is not treated in time, then they may be fused with each other, which is known as bony ankylosis. Fusion of the joint, fusion of the two bones which are part of that joint, okay, is called ankylosis. If the bone fuses with the bone, with some bony type of tissue, bony ankylosis it is called. Sometimes there is fibrous ankylosis also. The fibrous tissue are fusing the end of the bones. Now, tell me one answer here. After bony ankylosis occur, can the person use that joint? Can the person? Yes, what is the answer?
No, sir.
No. Exactly. The answer is no, because there is a fusion of the bone which are part of the joint. Now they cannot move at all. So how can the person use that joint? Okay. So there is permanent destruction of the joint if septic arthritis is not treated in time. Because of this single reason, this topic is very, very important for us. So we need to diagnose this in time and go for the appropriate treatment. Let's move on. Now see that those different pathophysiological steps are shown here in a picture form. So here the infection has started. Okay, here is a joint inside this is a joint, isn't it? So infection has started. Now see this, there is an attack of articular cartilage. This is called articular cartilage, which is covering the end of the bone. Now see this, there's a destruction of articular cartilage. Where is this thickness here? It is disappeared. You cannot see it anymore. And the end of the bone are also eroded. And now they are fused with each other. This is known as bony ankylosis. This is the permanent destruction and fusion of the joint. This is a very serious complication. Now, these are the pathological features. These are the pathological features of septic arthritis. We already know the pathophysiological mechanism. Now, this pathology is very easy for us to understand. In the beginning, there is acute inflammation, there is thickening, congestion, and edema formation of the synovial membrane. And after that, there is formation of the fibrinopurulent exudate. And later on, it will be converted into the pus. Okay, the frank pus is formed inside the joint. The synovial fluid has very high levels of polymorph or neutrophil. And for the diagnosis, we need more than 50,000, okay, of the neutrophils there. 50,000 of the WBC, I should say, and 75% of them should be neutrophil. The articular cartilage is destroyed and healing results in fibrous or bony ankylosis. Fibrous ankylosis is better here than bony. Fibrous ankylosis can still be, we can still remove those fibrous septa or fibrous band, and still something can be done. But once bony ankylosis occur, we have lost the function of the joint. Then only one treatment is left behind, that is total arthroplasty. Now, with this information, let's talk about the clinical feature, how the patient presents to the hospital. In a child, septic arthritis usually affects the hip joint. In adult, the knee is most often affected. So the local features include all the features of inflammation should be there. So it is very easy, answer for you. Overlying skin is red and warm because of the serious infection going on in the joint. It is swollen, it is painful joint. The person cannot bear weight at all. The person cannot move. Okay, so there is severe pain on the movement of the joint. Now we already talked about there are two types of movement. in the joint. One is called active movement, another is passive. Active means patient himself or herself is moving the joint. And passive means patient is not doing anything. You are moving the joint during your examination. In both these examination, there is severe pain during the joint movement. Patient will refuse to bear weight, or patient will unable to bear weight because of severe pain. This is the very important feature of septic arthritis. Now, regarding the general features, patient may be having tachycardia and swinging pyrexia. The fever is high grade here, high grade fever, and there is tachycardia as well. Now, some of the important points we like to highlight here. It may present as irritability in children. Okay, in the beginning, just irritability. And when parents, touch that area, touch that joint, the children will cry even more. More than one joint may be involved in the child. And sometimes, okay, there is widespread septic arthritis occur, especially in the newborn. See this, if the baby, okay, we're talking about the newborn, then widespread type of septic arthritis occur, and it is associated with septicemia. This is known as Tom Smith arthritis. So we remember this by special term, a name, Tom Smith arthritis. So if it is asked in the MCQ exam, just remember a newborn baby is affected and multiple joints are involved with pus formation inside. What investigation you like to do in a case of septic arthritis? Let's talk about it now. Blood culture. Now, why blood culture is necessary here? Yes, who can answer this? Why?
May be heterogeneous septic.
Exactly. Because remember, one of the mechanism is hematogenous spread. The bacteria which is present in the blood, the same bacteria may enter into the joint and can cause the disease. That's why blood culture is very, very necessary investigation. Very nice. Another is complete blood count. We always do that because this is a case of infection, always. And if we do, there is leukocytosis seen. Okay, leukocytosis. And majority of those leukocytes are neutrophils. So you can safely write neutrophilia here. Erythrocyte sedimentation rate is increased. This is called acute phase reactant, just like C-reactive protein. Both of these are high. Another very important part of the investigation is aspiration of synovial fluid. We have to aspirate it. And it looks frankly purulent in septic arthritis. Okay, it looks like a pus. And when we send that to the microbiology lab or pathology lab for the investigation or the examination, they will report, okay, very high WBC count, very high WBC count, usually more than 50,000. Some of the textbook even mention more than 80,000, okay, with 90% neutrophil. But for the definition, more than 70% or 75% neutrophil, that would be enough. These are all relative things, Even, let me talk some practical points here. Don't go absolutely with this type of criteria. Even if the count are 20,000, for example, and 70% of them are neutrophil, I'll still treat this patient as septic arthritis. Who knows? This patient may have taken some antibiotics before coming to the hospital. So the typical book picture may not be seen in the patient. So we need to slightly modify the practical guidelines here. These are the typical book guidelines. Okay, practically, we need to consider it much more earlier than these values. Now, if we analyze the glucose will be low. Protein level will be high. It may be higher than 4.4 milligram per deciliter, but if it is more than 3, okay, more than 3, then also we consider this as an exudate. And because of the combination of all other different clinical features, I still go for the treatment. there are no crystals deposition inside the joint. This may be one of the important differential diagnoses of septic arthritis, like a gout or pseudo gout, especially the gout. Which crystal is deposited in the gout? Which crystal?
Uric acid.
Uric acid crystal.
Very good.
Uric acid.
Very good. Uric acid crystal. So in that gout or deposition of uric acid crystals inside the joint, the signs and symptoms are almost, it looks like septic arthritis, though there is no fever, but the local examination of the joint is very painful, okay, or tender. It looks quite red. There is increased temperature, and all those things are matching. So we need to rule that out. No crystal should be seen. And positive gram stain results usually occur. The most common organism is Staphylococcus aureus. So you can answer gram of positive cocci in clusters can be seen. But according to the situation, other bacteria may also be there. Anti-streptolysin O titer is necessary during investigation. Now, the question is why? Why we go for this? Anyone?
Rheumatic fever.
Rheumatic fever.
Very good. To rule out rheumatic fever. Excellent. Because rheumatic fever also causes arthritis. And if you remember, in rheumatic fever, the joint is so painful, so red, okay, so tender, and it is hot also. So to rule out that differential diagnosis of rheumatic fever, better to go for ASO titer. That is excellent explanation for you. Now, remember, infective endocarditis can also lead to involvement of the joint. So to rule that out, you can listen for heart murmur, okay, or you can examine for Duke criteria. Now, let's not go into the detail. This is purely a medical discussion if I go there, but Duke criteria have certain major and certain minor, criteria there. Among the major, echocardiography finding and positive blood culture are the important one, and the minor have so many others, okay? So important point here is rule out infective endocarditis as one of the differential diagnoses. Now, once again, this is such an important point. So we have given one more slide for this so that a student can clearly know that this is an important part of the lecture. Appearance of the synovial fluid is turbid or frankly pus. Okay, turbid means it is not clear anymore. Regarding the WBC, okay, they are in thousands. Okay, they are in thousands. Remember this much. And predominance of neutrophil, 70 to 80% of the WBCs should be neutrophil. Crystals should not be there. No crystals. And culture, okay, usually should be positive. The importance of C-reactive protein, which is known as negative predictor. Now see here, if the CRP is less than 10 milligram per deciliter, the probability that the patient doesn't have septic arthritis is 87%. This is excellent type of data for us. What does that mean? CRP is always high, and usually, not always, it is not 100%, so I don't use the term always here, but in majority of the cases, CRP is high. If CRP is less than 10, means the negative predictive value of that is very good. Means there is a very, very less chance of having septic arthritis. 90% of cases of septic arthritis are monoarticular and 10% are polyarticular. Means multiple joints are involved only in 10% of the time. Now, okay, I'm not going to do this on my own in this class, but this slide is giving you a lot of important, concept. See this. This is the different type of examination we do on synovial fluid. Appearance, viscosity, white cell count, what is the percentage of neutrophil, what is the report of culture, and what are the associated conditions. So these are the normal thing. Appearance is transparent, clear. Viscosity high. It's quite viscous type of joint fluid in the normal case. White cell count should be less than 200. And polymorphonuclear count should be less than 25%. So if you remember this normal one, then it is very easy to identify whether the report is abnormal or not. Let's talk about the non-inflammatory, conditions of the joint. Now see this, okay? It is same. Everything is same like a normal one, but these are the uh, uh, associated conditions where non-inflammatory, affection of the joint occur, like degenerative joint disease, also known as osteoarthritis, trauma, neuropathic joint. Okay, neuropathic joint. One of the important causes is diabetes. Pigmented villonodular synovitis, a type of synovitis or inflammation of the synovium. SLE, and acute rheumatic fever. In all these are the findings. Inflammatory. Now look at the associated conditions first. Rheumatoid arthritis, crystal-induced arthritis like gout or pseudo-gout, seronegative arthritis. Okay, seronegative arthritis means the antibody, is usually negative there. Systemic lupus erythematosus and acute rheumatic fever. So both these SLE and acute rheumatic fever can have a non-inflammatory type of finding or inflammatory type of finding. And this is the finding here. Appearance is opaque, or it may be translucent in the beginning. Viscosity is a bit low. White cell count are high now. See this, 5,000 to 75,000, and it is more than 50%. Whereas our topic for today is a septic arthritis, and these are the finding here. Appearance is opaque or frank pus. Okay, viscosity is variable. In the beginning, it may be thinner because of the exudate. Later on, it may be thick pus. White cell count more than 50,000, and polymorphonuclear cell more than 75%. So this is highly suggestive of septic arthritis. And if we do culture, it is often positive. And associated conditions are bacterial infection, okay, somewhere else in the body, or patient may have compromised immunity. So please revise this, and if a similar type of situation is given in your exam, don't mess it up. Now let's move on. What are the other investigation we like to do in case of septic arthritis? This is a radiology. Okay. So let's talk about this, and then we take a short break after this. Regarding the radiology, it may look normal for the first 2 to 3 weeks of the condition because the destruction has not occurred in the joint till now. That's why in first 2 to 3 weeks of the condition, the normal the ordinary X-ray, I should say, is looking normal. After this initial period, radiology may reveal, see here, patchy rarefaction and a narrowed joint space. Patchy rarefaction means a bit of osteolytic areas start to appear on the end of the bone inside the joint. And because of the destruction of that articular cartilage, the two bones are coming closer to each other. That's why there is narrowing of the joint space. A healed infection may cause bony ankylosis, means fusion of the joint. So we can clearly see that in the X-ray. And if hip joint is affected, one of the most frequent sites for attack, especially in children, the femoral head may appear to be completely absent. Okay, the femoral head is completely destroyed by the infection. That can even occur in case of children, and we can clearly pick that with the help of X-ray. Now see that? So again, some more important point or a bit of elaboration. In septic arthritis, infection gives rise to joint effusion and swelling of the adjacent soft tissue. Joint effusion. What do you mean by joint effusion? What is the meaning of that? Yes?
Collection of fluid in the joint space.
Excellent. Okay, same type of term like pleural effusion or pericardial effusion. Collection of free fluid inside the joint is called joint effusion. So if the exudation is maximum, there is a severe collection of the fluid inside the joint, and it makes the joint swollen. the bone on each side of the joint may become demineralized. This is known as focal osteopenia. This is again a feature of infection there, and later on there may be complete destruction of the articular cartilage. The same type of discussion which we have just done. Now some of the X-rays you can see here. Just focus here now. Okay. This area. Okay. Just focus on this part here. So there's a soft tissue swelling, okay, which is not, properly seen on the X-ray, but we can always find it out by our clinical examination. Periarticular osteopenia can be seen. See this. This is called periarticular osteopenia. Look at the, density of the bone here. The density is definitely decreased. This is the normal density of the bone. Here, the density is decreased. So periarticular osteopenia. And joint space become narrowed because of the destruction of the articular cartilage. The two ends of the bone are coming closer to each other. So these are some of the important X-ray findings. So we're talking about the radio diagnosis of septic arthritis. Okay. So before the break, we talk about, how the joint is affected by septic arthritis, and that is seen in the X-ray. So one is periarticular osteopenia, as you can see here. Another is erosion of the bone and destruction of the articular cartilage, so that there is narrowing of the joint space. These are very important points. So this is also showing the same thing. This is a lateral view and this is a AP view. Now, to confirm your diagnosis, okay, you should have three things together: the points from the history, points from physical examination, and points from investigation. Now, only the important features are included here. Okay, so this is the important slide from the exam point of view. See here, if Staphylococcus aureus is the causative organism, then these are the clinical clues for you. Okay, overall, the patient is healthy. There may be a breakdown of the skin, and through that Staph aureus has entered inside, or there may be a previously damaged joint, or there may be a prosthetic joint, or sometimes the joint is absolutely normal and the organism has reached there through the hematogenous route. If streptococcal, organisms are responsible or the causative agent, then again the person may be healthy adult, and there may be splenic dysfunction. Very important term. The spleen is not working properly. So what are the causes of splenic dysfunction? Anybody? What are the causes? Yes?
Autosplenectomy.
Very good. Very good, Rana Atisam. It's autosplenectomy, which is seen in sickle cell anemia. Excellent. Another is, for example, sometimes there is a big cyst present inside the spleen. Sometimes we have to remove the spleen because of certain hematological disorder. Okay, so all these are the important causes. And if spleen is not functioning well, then capsulated organism cause infection very commonly. And pneumococci is a good example of capsulated organism. Now, Neisseria gonorrhoeae can cause infection in healthy, sexually active young adult, but even the neonate are affected because of the transmission from the vaginal route. Associated tenosynovitis or vesicular pustules are seen in gonorrheal infection. Tenosynovitis is the inflammation of synovial sheath which covers the tendon. There may be late complement deficiency, okay? That remember the membrane attack complex is not properly formed, then there is a high chance of gonorrheal infection, and there may be negative synovial fluid culture and gram stain. Aerobic or anaerobic gram-negative bacteria may cause the infection in immunocompromised host, and because of the GI infection, because these organisms are very common inside the GI tract, they may migrate from there to the blood and then to the joint. Brucellosis is a type of zoonotic infection. Okay, zoonotic means the infection which is transmitted from the animals. And which animal is commonly associated with Brucella infection? Which animal? Yes, which animal is that?
Rodents.
Okay, they are usually a goat. Okay, goat or even other animals, you can say. But goat, don't forget, goats are the commonly associated animal. Mycobacterial species, in case of immunocompromised host, fungal immunocompromised, there's no doubt about it. Spirochete like Borrelia burgdorferi is a tick bite, so there has to be the exposure to the tick, and there is the antecedent rash in case of Lyme disease. Rash is very typical, and Mycoplasma hominis is a type of bacteria which is known as atypical bacteria. So immunocompromised host would be affected, and there may be prior urinary tract manipulation like catheterization or some type of surgery in the urinary tract. Apart from this is the very important point I've discussed so many times in today's class. So this is how the synovial fluid aspiration report looks like in case of septic arthritis. Okay, you can go through this on your own. Now, the final part of this discussion is the treatment and some complication. So let's talk about them one after other. Patients with suspected septic arthritis should be referred urgently and immediately to the hospital. If you cannot handle that case, okay, then it should be referred urgently and quickly because of the potential complication which can develop. Synovial fluid should be obtained because of the aspiration and sent for gram stain, culture, and crystal analysis. This is considered a part of management itself because it is so important for the proper diagnosis. Following the joint aspiration, we start empirical IV antibiotic. Okay, empirical IV antibiotic. Now we all know which antibiotics are those, isn't it? So see that. So which antibiotics you want to prefer here? The anti-staphylococcal antibiotics. Asked this question so many times. Anti-staphylococcal antibiotic. Flucloxacillin, cloxacillin, nafcillin, or even fusidic acid can be provided. Now, if you strongly suspect they are MRSA strain type of Staph aureus, then we have to go for vancomycin. At the same time, okay, if you suspect some other type of organism like streptococci and Haemophilus in children, then some other antibiotics should be added there. Maybe third generation cephalosporin is a wonderful choice that can cover all these organisms. Let's move on. The regime can be modified in the light of culture and sensitivity result. This is a very basic discussion, isn't it? We always do this. Why? We have sent the culture and sensitivity test because of this. Because we believe the culture report will come positive and we know which antibiotics works for this bacteria. Treatment should be given for several weeks, at least 6 to 8 weeks, but the optimal duration of therapy is unknown. Sometimes according to the organism, it may be longer or it may be shorter than that. So what is the guidance or guideline for us? Remember, all the clinical features should disappear. ESR should come back to the normal. CRP should fall, okay? And patient should be able to bear weight. These are very important points, okay, for the duration of therapy. Where the joint is accessible, needle aspiration should be used to decompress the joint. Now, it is very easy to decompress the knee joint, but it is a bit difficult to decompress the hip joint because of its anatomical location. So whenever it is easy or possible to decompress the joint, put a needle, very sterilized needle, and aspirate. So it will really help in the recovery of the patient. Now, we already talked about antibiotic treatment is usually necessary for up to 6 weeks in septic arthritis. and 2 to 3 months in associated osteomyelitis. Osteomyelitis even for 2 to 3 months. Now, there are certain age group where osteomyelitis and septic arthritis can occur together, okay, especially in very young children. So they may be given a bit longer type of treatment. An antibiotic regime use is dictated by any local specific bacterial resistance. Now, this is the principle of infection and choice of antibiotic. We have already done this in the discussion of internal medicine. When we choose empirical antibiotic, there has to be some guidelines for us, how to choose. And that guidelines or guidance is provided by the resistance pattern in that particular area. Some experiment, okay, some research would be already done regarding this. So we need to see the report, which organisms are common there, which antibiotics are killing those organisms. That will strongly guide us for our empirical treatment. Now, antibiotics of choice should be able to treat Staph aureus and other gram-positive cocci in adult, like flucloxacillin and fusidic acid or clindamycin. Every student know that. Flucloxacillin and fusidic acid and clindamycin is also anti-staphylococcal, but it also acts against anaerobe. Okay, and if staphylococcal is showing the resistance to beta-lactam antibiotic, I want to go for vancomycin. Or MRSA resistance, I'm going for vancomycin. These all are actually resistant to the beta-lactam antibiotics or beta-lactamase enzyme, which is produced by the organism. This flucloxacillin is already resistant. But my point here is, if methicillin resistant strain is there, then only I go for vancomycin. Now, Haemophilus influenza in children under the 3 years of age, we can go for amoxicillin or a cephalosporin treatment. 3rd generation cephalosporin would be very good here because it can cover other bacteria as well. Gram-negative organisms in the elderly and in those with a predisposing disease like rheumatoid arthritis, we go for, again, 3rd generation cephalosporin. Now, if you want to remember the easy antibiotics here, okay, just remember flucloxacillin as one of the antibiotics which cover Staph aureus, and 3rd generation cephalosporin like ceftriaxone. So if you are in doubt, safely combine these two together and you don't need to worry much. So flucloxacillin with ceftriaxone is an excellent combination in the treatment of septic arthritis. Let's move on. Now, we already talked about important not to start an antibiotic until the bacterial culture samples have been taken, and do not give the antibiotic by injection into the joint. That is a common temptation, isn't it? The joint is affected or infected, so why not? We give antibiotic directly into the joint cavity. This is not done. Okay, this is not helpful. We need to give IV antibiotic. And then do not give antibiotic so early that by that time we have not taken any sample for the culture. That is not a job of a good doctor. That is a job of a paramedics, because they don't know the importance of this culture and all those things, or they don't have the facility. But we have, and we have to treat according to the principle. Okay, remember that. Response to therapy may be judged by the clinical features, fever, and acute phase reactant are the marker like CRP and ESR and white cell count. Already talked about. Okay, clinical features should disappear. Fever should come down, or fever also should disappear. The acute phase reactants should come back to the normal, and white blood cell count should also normalize. Then I can switch that antibiotic to the oral one and can discharge the patient, or according to the situation, I can discontinue the antibiotic also. Now, what about the surgical therapy? Now, till now, we are talking about the medical treatment, but what about the surgical one? Now, see here, surgical drainage is indicated using either arthroscopy or arthrotomy. Arthroscopy or arthrotomy. Arthroscopy is done with the help of arthroscope. That's a special instrument. So that instrument is inserted into the joint cavity, and then, okay, the pus is removed. The damaged or dead piece of tissues are also removed. Whereas arthrotomy is an incision or nick given on the surface, and we open the joint and we drain the joint. Arthrotomy is particularly useful for the shoulder, okay, shoulder or hip, if aspiration is required more than 3 times per day, or if adjacent soft tissue is affected. So this is one of the indication. If you have to repeatedly go for aspiration of the joint, then why don't you straight away go for arthrotomy? Okay, that is the concept. And it is also done if there is no response to 5 days of aspiration plus antibacterial therapy, or if the joint is difficult to aspirate. So we go for arthrotomy. Arthrotomy is a surgery. Remember that it is always a bit complicated than a joint aspiration. But if it is necessary, then we need to go for it. So these are certain indications. Now, surgical drainage, okay, is arthroscopic drainage or arthrotomy, two important type. So this is arthroscopic debridement, which is shown in the schematic diagram. So these are the arthroscope which are inserted here. And there is a debridement done, means removal of all dead and devitalized tissue. And there is a copious irrigation done with normal saline. So all the pus is removed and the joint cavity is cleaned. Now, the final part is the complication. Now, what complication can occur as a result of septic arthritis? See there. So these complications include chondrolysis. Chondrolysis. What is the meaning? What is the meaning of chondrolysis? Yes?
Sir, the breakdown of the cartilage, sir.
Exactly.
Lysis of cartilage.
Exactly. Lysis or breakdown or destruction of the cartilage. This is one of the part of the disease itself. And as a result of this, there is a high chance of, fusion of the joint later on. Septic dislocation of the joint. Because the infection, there is severe damage of the joint and they can be dislocated. Avascular necrosis can occur, especially in the hip joint. Avascular necrosis of the femoral head. Shortening or lengthening of the limbs both can occur, but shortening is more common than the lengthening. And again, it is because of destruction of the cartilage there. This is the epiphyseal plate of cartilage. And late degenerative changes can occur. This is very important one. Even if we treat, okay, but a bit of late treatment is provided to the patient, but complete treatment is given. Because of all these damages done in the joint, later on, this patient will develop osteoarthritis. See that? It is known as osteoarthritis. So this is a degenerative, disease of the joint. And it is a painful condition and the joint is swollen. So osteoarthritis. It can be a late complication of septic arthritis. So with this, okay, I have concluded the discussion on